you dial 999 and ask for an ambulance, your call will be one of 10 million the service in England handles every year. It is a service revealed today to be under pressure for several different reasons. According to the regulator, NHS Improvement, those include a fleet of ageing vehicles, not enough take-up of new technology that could help with call handling and treatment, and problems with staff. The review was led by the Labour peer Lord Carter, a non-executive director at NHS Improvement. And we're also joined from Cardiff by Martin Berry, registered paramedic and trustee of the College of Paramedics, which is the recognised body for the profession. Good morning.
Good morning.
Lord Carter, those problems with staff that I mentioned include the highest level of sickness in the NHS, the greatest number of complaints about bullying and harassment. Why is that worse in the ambulance service than elsewhere in the health service?
I think because working on the front line in the ambulance service is a very demanding job. You're called out to very difficult situations. It's very stressful. But having said that, of course, it varies in various parts of the country. Some people are managing that somewhat better than others.
Some trusts.
Yeah, some trusts.
But
exactly.
your report calls for more treatment to be carried out at the scene. Now, wouldn't that increase the pressure on the paramedics compared to taking people to A&E?
No, I think not, because I think, first of all, one of the great things about any of these jobs is the satisfaction of getting it right. And what we do see in parts of the country is the conveyance to hospital is much lower. And that's because I think people are better trained, better understanding, and better organised in their work. So it's the support mechanism behind the paramedic, I think, makes a great deal of difference.
Martin Berry, what do you think of what Lord Carter's concluded?
Yes, Lord Carter does make some really valid recommendations within the report, and many of the recommendations and suggestions have been discussed and around for a fair while, and there's already been significant work to try and better manage patients. And paramedics and their clinical colleagues work very hard to ensure that patients, when it's safe to do so, we can manage in the community. But what we need to see is a far more collaborative approach across all the services. A lot of the services see the ambulance service merely as an emergency service and then don't necessarily think to involve them in community social care or mental health services. So I can reflect on my own experience. One of the biggest challenges we face is to better manage patients presenting with a mental health problem. Patients who are in crisis access the emergency service, don't need to be taken to A&E, shouldn't be taken to A&E in the vast number of cases, but we struggle to link in with other services, especially out of hours, to try and make sure those patients are cared for.
Would you be worried about a directive that calls for more patients to be treated at the scene? I mean, you still do shifts, don't you? You're out and about, I guess, just with one other paramedic. Would you feel under too much pressure to deal with things there and then rather than take a patient somewhere else?
I'm fortunate to have done a fair few years and I'm quite comfortable in being able to manage patients and again, when safe to do so, leave them in the community. And modern paramedic education is preparing paramedics far more to better assess and safely manage these patients in the community. But it is right to be aware that we have a large workforce where the expectation on them has radically changed over the last 10 or 20 years, and that support and development needs to come both in education but as a system-wide approach to ensure that when decisions are made they are supported, it is encouraged, and it needs to be upfront as an agenda because we need to manage these patients effectively.
And Lord Carter, some of what you've pointed to is really basic stuff, paramedics relying on ageing vehicles. I mean, did you actually find that vehicles were not reliable?
Oh, yes. I mean, in some parts of the country, we have people sort of patching and mending far beyond the time when the vehicle should be dispatched and got rid of. Absolutely. So we need to keep up the investment and keep that fleet modern. And also, we need a more standardised fleet. We have 34 different sorts of ambulances. So it's not quite a national health service in that sense. We need more standardisation.
And better technology. That's another thing you
totally.
pointed to. That what exactly is going wrong there?
Well, I think that the whole issue is access to patient records. So when an ambulance crew arrives, when a paramedic gets there, in a sense, their first encounter is what they see. Now, once they start to look at the patient, if they can get the patient's historic record called up electronically, it'll save them a great deal of time in
And
the
they
diagnosis.
can't at the moment,
No.
Martin Berry, is that right?
In many cases, that is correct. If I, again, use my own experience, if I'm working in London, for example, and I may work a 12-hour shift, I might end up going to 5 or 6 different hospital trusts, all using different systems, all have different record-keeping services. So it does make it exceptionally difficult if we do go to a patient with some sort of chronic health problem, such as COPD, that we want to manage in the community, and I need to have a better understanding of their medical record. I might want to even access or discuss the case with their consultant.
Yeah.
It's incredibly difficult to do that.
Martin Berry and Lord Carter, thank you both.